for our Woodlawn Health Report as we welcome Brad, Carissa, and a special guest. We'll get to that here in just a few minutes. But good morning. How are you, Brad?
We're doing well. We're doing well. Thank you.
Good, good. Glad you could join us.
Absolutely.
Another
we
month
said we'd
down
do
the
this.
books. Yes.
We said last month we'd do this, right?
Uh-huh.
And then I think you've even threatened me a few times in the community with quoting to me how many days are left till
Yes.
Epic.
And how many?
There are 16 days left until Epic.
We are in the teens.
That's right. That's right.
It's crazy. Did you ever think you'd get to the teens?
No. And you know, when two of my children were younger, I didn't think I'd get through the teens.
Now you're back in them.
Now we're back in them. It's exciting times. Absolutely exciting times.
How's things going overall?
You know, I think better than we expected. And I only say that because there's so many classes. We have 270 education classes that have been scheduled for our team members. And we are running very, very close to perfect.
Good.
And getting everyone through all those classes, which Epic is unique. Epic requires that every employee, provider from bottom to top has to go through the classes and pass the test before they can ever go live. And so what they do is different than what I've experienced in several other systems in the past. Many of those other systems, you might go through the classes or do some of the computer-based learning and those kinds of things, but you're given your username and password and you can log in when it's time. Epic won't allow that. So if you don't get through your training and pass the courses,
You're not getting a username.
you don't get to go to work on that day and take care of patients.
You're going back to the classroom.
You're going back to the classroom, and absolutely, you got to get through that process, which is really good if you think about it. I mean, it ensures a base level proficiency from everybody.
Okay.
You can't play unless you take the time and do the work. So we are excited about that. They've really exceeded that expectation.
I know you were nervous last time I saw you last week. You were having to go back and sit in some time for you to learn things. How did that go?
You know, I did my classes this week, and what I will say I've got two perspectives. One from a management perspective, it's relatively easy to navigate when you're just getting in looking at things. From a clinician's perspective, you know, being a physical therapist for 20 some years and working through different EHRs, my goodness, I wish I would have had this before. It's so intuitive.
Yeah.
There are typically 2 or 3 ways to get to the same data. So as a clinician, you can click one of 2 or 3 different boxes to get the lab values or to get the imaging values, or imaging reports, those kinds of things. Having worked in 2 separate systems for the last 20 years, boy, having that one system would have been amazing. You can see physician office notes for your patients. You can see when they're being scheduled already to go back and see their physicians. You can get lab values. You can pull in all that data from other places. That literally is like 2 clicks, and you could pull in the data from Cleveland Clinic if you needed to.
Wow.
What I heard when we were getting the pitch to get Epic and what we were kind of told during that process, what you can actually do is even more. And so rarely do you have a situation where it kind of exceeds your expectations. I know right now we're all in that baby stages part, we're just learning it, but fast forward a year from now when everybody are truly proficient, super users, so to speak, it's going to be amazing what we're able to do much faster than in the past.
Obviously, remind the listeners too that come out that still be patient. There's going to be some hiccups.
Absolutely. You know, we go live with Epic, and since we're kind of talking about it, we'll finish this portion out with our Epic discussion. We go live in 16 days. In the Friday the 13th at 10 p.m., things switch from one system, and then we transition through that night so that on the 14th around 5 to 7 a.m. we're up on a new system. And that system is Epic, and it'll get rid of our 2 systems and bring them to 1. We'll get rid of our 2 portals, and you'll have 1. MyChart will be coming out. We'll be getting information out to everybody in the next couple weeks. That's an exciting portal that you could do everything from register, pay your bill, send a request for your medication refills, an email to your physician or to the clinics, eventually schedule visits, all of those kinds of things through that one app. So It is very, very exciting. But yes, be patient with us. We're kindergartners right now, people. We're just learning what we're supposed to do and when to take a nap. So be patient. It's going to take longer to get you registered and get you through that system. Some of the staff members, as you ask them questions, it may take them a little longer to respond. Hey, I might have to write your number down and call you back, because there may be questions asked that I don't know exactly how to answer. So the end result is going to be amazing for the community, but right now we're going through that process. So be patient, give us a little grace.
And something else I think we should also mention is we will have the laboratory. They are going to be closed on that June 14th date. So if you need to get labs, please schedule accordingly to either come that Friday before, earlier in the morning would be my suggestion, or come on that Sunday or Monday. The lab's going to be closed, and the reason why is they need that time to transition without having patient care. So inpatients will still be able to get labs, but all outpatient labs for that day will be closed. So just if you need labs, please plan accordingly to that. We want to just be upfront about that ahead of time.
Yeah, we'd hate for you to walk in after you'd not eaten all night on Friday night to Saturday and expect to be able to get your labs, and we can't do them. But there's a lot of work that has to be done on the backside with interfaces. The new system, again, being what it is, it will allow the upflow of information from all of our diagnostic equipment directly into the system, and that's just going to take some tech people, a lot of work on the background, and they start around 10 o'clock that night before. So that next day, like she said, no outpatient labs available.
Exciting times coming in the next 2 weeks.
Oh, absolutely, absolutely. If you guys want to stop by and, bring caffeine starting next weekend and the weekend after, please do so. We'll be happy to take it.
Any particular kind?
Coffee,
pop, it doesn't matter?
No,
just
hot,
caffeine.
Cold, lukewarm, it's all going to work. Absolutely.
Speaking with Brad and Carissa from Woodlawn Health here this morning, how was the board meeting?
Well, we had a good board meeting yesterday. A couple things we always talk about. First off is financials. April was a busier month. We had a operating revenue of about $19,000. So again, operating revenue is what we always want to get to in a positive way, because that is what we do inside the four walls of the hospital without any outside additional revenue or influences. So we had a $19,000 operating revenue for the month, which is great. And that led to an overall net revenue of about $331,000 for the month. Overall, our patient revenue is above budget by about 1.6 this year, year to date, and that's about 4.2% higher than it was the same time last year. So what we've seen over the last couple years is kind of a steady growth pattern. If I look at the numbers going back 10 years, we kind of peaked with volumes in late 2018 and 2019. And then the world went crazy in 2020. I don't know if you guys remember that.
Barely.
Correct. And so we're now we've hit that back upswing the other direction, and now I think we're starting to see some growth above that pre-COVID number, which is wonderful.
Awesome.
We've seen some phenomenal growth, 12% up in our OB department. We had 27 deliveries last month, which is a significant number. So we thank you for giving us the opportunity to care for you and your little ones. We're here for you, and we're still taking new patients. So come on by. One of the things we do every year is we do an outside audit. So financially, since we're a not-for-profit and since we're county-owned, we hire an outside company, Blue & Company, out of Indianapolis, a large accounting firm, and they come in and audit the books. And so we do that for lots of reasons. One, transparency, and two, we're required to, but that result was really, really good. We have now consistently for the last couple of years had what they call a clean audit, which means no findings of any kind. And really what they're doing is they're looking at our financial statements and then our processes of how we do checks and balances to make sure that we are good stewards of the money that we are receiving and that we are utilizing back into the community and to the hospital. And so that came back with no findings from that group, and we're very happy about that. Other things, we didn't get a chance to talk about this yet, but I want to say a big congratulations to Troy Philippi. Our emergency room director was the winner, or loser, depending on your perspective, of Fulton County Sheriff's Department Ride the Lightning event. That raised money for the Fulton County Shop a Cop program. And I don't know if you guys know Troy Philippi from our ED, but if you do know him, you know that this event was a perfect fit for his electric personality. And so, congratulations, Troy.
I heard he's volunteered someone for next year already too.
Well, that'd be interesting to see how that plays out. I wish whoever that is the best of luck and potentially not winning next year.
But I just think this shows for us as a organization, right, how much we're willing to get out in the community. Those funds went for Shop a Cop, and so with the full support of our organization, Troy was able to participate in that, and they raised a substantial amount more money this year than they did last year. So it just shows our commitment to this community as well. And as Troy told me when I asked him the pains we will go to make sure that everybody is cared for and that we're giving back. So I just think that's a huge representation of that.
Yeah, Sheriff Eichmann did an amazing job on that program and picking the right individuals to ensure a good turnout for the kids. Because really that's what that program's for, right?
Exactly.
It's receiving money so that they can then get some things for the children. So
Great opportunity.
We're glad to sacrifice or to put out there that team member for that project. Let's see, MD Save. I think we've talked about it a couple times, but I want to mention again, mdsave.com, capital M, capital D, save.com. You can get online through our website, and you'll see a link, and it's a place where you can go and get a significant savings on laboratory testing and medical imaging tests. I bring that up because we're starting to see a consistent group of people go and utilize that, and that's wonderful. They're saving thousands of dollars by going online and getting that.
Cool.
So you can get online, you can type in the test that you need. If you have a high deductible health plan, if you're self-insured, you want to just pay cash and not have to go through your insurance, for whatever reason, you can get on that program and you can buy a coupon for whether it be an MRI, an X-ray, or laboratory testing, and you can bring that in and we'll honor that here at Woodlawn. It allows you to shop around too. I don't want to direct you and say you have to come to Woodlawn, but what you'll find on there is that our pricing is better than the competitors around us through that program. So don't forget that that's out there. We want to make sure that if you're struggling to figure out how to get something done, that we give you avenues to get there, and this is a great avenue for that.
Awesome.
Absolutely. And then Krista, who's your buddy today?
My buddy. So we were really excited last year that we were able to bring on a marketing intern, and then we're able to transition her to being full-time. So I'm Michaela Lee here. She is our new marketing coordinator. So if you're out and about in the community, you'll see her. As you all know, we like to be out in our community, but we have outgrown the one-person role, so we need two people to help us with that. So Michaela, can you tell us a little bit about yourself?
Yeah, of course. So hi, I'm Michaela. I recently graduated from IU Bloomington with...
Go Hoosiers.
Yeah, go Hoosiers.
Go Big Red.
With a bachelor's of advertising, PR, and strategic comms.
Cool. So, in other words, marketing.
Yeah.
In the simple terms, right?
Yeah.
So, where'd you originally come from?
I grew up in Fulton, Indiana.
Okay.
So I
Back home.
Yeah, traveled like 3 hours every summer, and before summer to go to IU Bloomington.
Okay.
Yeah.
Awesome. Well, good to have you back in the community.
Thank you.
We're very excited to have her on board. I also really want to talk quickly about two different things. It is community event season, so as soon as we go through Epic, we turn around the next weekend and we do a parade. So if you are out in Argus, please be looking for us. Our summer float will be coming, and we're going very beachy themed this year, so I think we'll be hard to miss. We're going to be bright and cheering. So that is happening on the 22nd, I believe, 21st or 22nd. And then we'll also be at the Miami County Fairgrounds in the youth building. So come out, we will have some operation games so you can try your hands at operation and see how good you are to win a prize. No patients will be hurt, but that will be a fun event that we're really looking forward to. It's always a great time for us the summer months when we get back into our community. And last but not least, in the next several weeks, do be aware that if you are on the schedule at Woodlawn, you might be getting an email that's going to be pushed out. So that is legit. It is not spam. I know in today's age and world we have to think about spam. It should be saying Woodlawn. If it says another health system such as Parkview, that's a possibility, but it shouldn't come. But just know that's a vendor of ours. It's not. There's nothing else about that but being a vendor. So just be aware of that. We will be putting out a lot more communication as we get closer and as it comes in. There's a lot of different things, but we're excited. What this will be able to do for our community is astounding. And I always use the example, my father has a system and a health system he's in, and I can log in and look at things 2 and 3 hours away from an office, with permission. And so it does a lot of good for me to be able to stay up to date with those type of information, along with being far away. So there's going to be lots of opportunities, not only for this community, but for children of this community as well, to be able to stay up to date on health information. So we're excited. And again, say bear with us. This is all going to be new for us, so please take and have some grace as you come into your appointments and going forward. So
One of the things that my chart does that we just didn't really even kind of think about initially was it'll allow us to push out information to everyone who has my chart within the Woodlawn community on anything we choose. Meaning we could be pushing out, hey, we got a health fair coming up on Saturday. Hey, this month is a mammography month. Please get in and get this done. Or let's say we have a really bad storm and we have to shut down a service. Hey, just by the way, did you know that this doctor's office is closed today because of weather? Like, it'll allow us to communicate to people for lots of reasons. So we're excited about that.
yeah.
16 more days.
Yeah.
16 and counting.
So, and if you have any questions about my chart or anything, there should be a lot of communication coming out as soon as a few days, even probably prior to going live. But please ask our team. And if they don't know, we'll make sure you get someone to know. It's going to be imperative for everyone who can sign up for the service to sign up for the service, for your experience, and to also, as Brad said, make sure we can get you reminders in a timely manner had there been an emergency case.
Absolutely. We're very much looking forward to it.
Brad, Carissa, Michaela, thank you very much. You guys have a great rest of your day. We'll talk to you next month when you're live.
We'll see how that works out. Absolutely.
Woodlawn Health Report here on Giant FM.